Imagine a disease that quietly lingered for decades, confined to remote parts of Africa, only to explode into a global emergency in 2022. That disease is Mpox, formerly known as monkeypox. How did it go unnoticed for so long, and could this outbreak have been prevented? Hey there, tech enthusiasts! Welcome to Not So Techie. Here at Not So Techie, we're dedicated to exploring the latest and greatest in technology and scientific breakthroughs. The content presented in this video is for informational purposes only. Not So Techie does not endorse or oppose the ideas, technologies, or companies discussed. In today's video, we'll explore the story behind the Mpox outbreak, its origins, and what the future holds for controlling this disease. Mpox is a viral disease from the same family of viruses as smallpox, first discovered in 1958 when monkeys in a Danish lab contracted the virus. Despite the name, the virus's primary hosts are not monkeys but small rodents such as Gambian pouched rats and rope squirrels, found across Africa. According to multiple reports, Mpox can be transmitted to humans through close contact with infected animals or people, often via bodily fluids, respiratory droplets, or skin lesions. Dr. Daimi Ogoina, a Nigerian infectious disease specialist, observed that Mpox outbreaks initially mostly affected children in rural areas who came into contact with wildlife. But in 2017, something changed. After a 39-year absence, the disease reappeared in Nigeria, and the number of cases began to surge rapidly. One of the leading researchers during this outbreak was Dr. Ogoina, who noticed a disturbing trend. Many of the Mpox patients were young men with genital lesions, a pattern unusual for what was once thought to be primarily an animal-borne disease. Ogoina was among the first to suggest that Mpox might be spreading through sexual contact, particularly among men who have sex with men, MSM. In a 2023 paper published in the New England Journal of Medicine, Ogoina and his team presented evidence that sexual transmission was playing a major role in spreading pox. On the global stage, the World Health Organization, WHO, declared Mpox a public health emergency of international concern in 2022, encouraging countries to strengthen their surveillance and responses. However, there has been some skepticism about how the WHO and other global health bodies handled the outbreak. Critics argue that the organization's approach, as seen in other health crises, was slow and bureaucratic, raising questions about whether earlier interventions could have prevented the virus from spreading globally. On a positive note, genetic studies led by researchers like João Paulo Gomes from Portugal's National Institute of Health have helped us better understand how the virus was mutating and spreading. According to evolutionary biologists Ain O'Toole and Andrew Rambot from the University of Edinburgh, the Mpox virus acquired an unusually high number of mutations, which aided in tracking its transmission pathways. Their research found that the virus had been circulating undetected among humans since at least 2017. These findings, while insightful, also raise questions about why earlier warnings from Nigeria weren't acted upon more aggressively by international health bodies. The response from countries like Nigeria, where the outbreak began, has faced substantial criticism. In his 2017 research, Dr. Ogoina pointed out that there was resistance to the idea that Mpox could spread through sexual contact, especially in Nigeria, where homosexuality is criminalized. This hesitation delayed critical public health interventions, and critics argue that both Nigerian and global responses were under-resourced and too slow. Even more troubling was the rampant misinformation surrounding the disease. According to a science article by John Cohen and Abdullahi Tsani, rumors in Nigeria described Mpox as anything from a spiritual curse to a form of biological warfare. This misinformation, combined with social stigma, discouraged many infected individuals from seeking timely treatment, allowing the virus to spread further. There's also debate about whether the global Mpox outbreak could have been prevented. Christian Happy of the African Center of Excellence for Genomics of Infectious Diseases believes that if Nigeria had implemented better surveillance and used vaccinations early on, the global spread might have been avoided. However, some argue that this level of intervention would have been challenging. Dr. Michael Worobe, an evolutionary biologist from the University of Arizona, pointed out in his research that cities like Lagos and Port Harcourt, with their dense populations and busy international airports, created the ideal environment for the virus to spread beyond Nigeria's borders. In today's interconnected world, controlling a virus in its early stages is more difficult than ever. What does the future hold from Mpox? While the WHO lifted its public health emergency status in 2023, the threat of future outbreaks remains high. A more alarming development is that a new, deadlier strain of Mpox has been circulating in the Democratic Republic of the Congo since 2024. This strain has already spread to neighboring countries, raising concerns about another potential global health crisis. While the WHO and Africa CDC have stepped up their vaccination efforts, such as the US donating 10,000 doses of the JYNOS vaccine to Nigeria in 2023 and the EU providing an additional 215,000 doses, there are questions about whether these measures are enough. Many experts argue that without significant investment in long-term surveillance and education, Mpox could re-emerge as a major health threat in the coming years. Despite the availability of vaccines, including the JYNOS vaccine that has been shown to prevent Mpox, some remain skeptical of the reliance on organizations like the CDC and WHO for guidance. While vaccination is widely recommended, especially for high-risk individuals, some argue that the approach to prevention should also include greater emphasis on public education, personal responsibility, and local health measures, not just reliance on global organizations. Prevention strategies, such as avoiding close contact with infected individuals and animals, frequent hand-washing, and monitoring for symptoms, remain critical tools in reducing the spread of Mpox. To sum it up, the Mpox outbreak is a stark reminder of how quickly diseases can spread in our modern, interconnected world. While we've made significant strides in understanding the virus and controlling its spread, challenges remain. Misinformation, stigma, and institutional slowdowns have hindered a more effective response. As we look to the future, the question remains: will the world be ready to stop the next outbreak before it spreads, or will we face similar challenges? Let us know your thoughts in the comments,